Ready?
Mm-hmm. Okay.
Okay, my name is Adeola. This is my poster for my capstone project. My capstone is on infection prevention after chemotherapy. First of all, I want to say a big thank you to my counselor and my instructor, Professor Barbara Satel, for all her encouragement, for the opportunity given to me to be able to do this, and for all our support too. Like I said, I'm going to go over the poster. Here I have the background and the problem statement, the purpose of the project, the goals and objectives, and the theoretical framework the project is based upon, and the literature review, the plan, how I went about the project, and the evaluation process of the project. First of all, let me go over the background and the problem statement. I work in the oncology unit of Robert Johnson University Hospital, and I know that we have a problem with infection because most of the patients, we found out that we've been having issues with the infection, and because of the infection, we find out that most of them are staying longer than necessary in the hospital, and we found out that we're having a lot of readmission in the hospital. And with the Affordable Care Act now, this is considered a non-event, and when you have incidents of non-events, Medicare and Medicaid will not reimburse you for all this. And not that alone. What about the patients? Because you want to be able to give quality care to the patients. And unfortunately, some of them even stay longer. We have patients that stay like 3 months just because of infection. And we even have some that have gone septic and they end up in ICU. We've even had some that could not survive and they eventually died from the infection. And so that's why I'm so passionate about this project. So my goal is to be able to make sure we reduce infection and to be able to reduce the cost of infection, because when people stay in the hospital, it's a lot of money to stay in the hospital for days or for months. And unfortunately, most of these costs are not being covered by insurance, and the hospital has to bear the cost. Okay, so I'm going to start chemotherapy, because the project itself is going to be on infection prevention after chemotherapy. We do know that after chemotherapy, there's what we call neutropenia. Neutropenia means the white count cells in the body go so low, and this is due to the chemotherapy, because what chemotherapy does is kills both the good and bad cells in the body. And because of the destruction of the white cells, so the immune system in the body is compromised. When it's compromised, patients are people that have gone through chemotherapy are at a higher risk to be infected. And we do know that infections have a negative effect on quality of life and patient outcome. And again, like I said earlier on, infection causes frequent readmission to the hospital, and it increases the overall length of stay in the hospital, and it puts a heavy burden on the healthcare cost. And again, like I did say, infection leads to morbidity and mortality. Like I said, I've seen a lot of patients that ended up being septic and couldn't survive the effects. And Medicare and Medicaid, like I said earlier on, now they're withholding reimbursement for never events, such as all these preventable occurrences. So the purpose of this project is to be able to organize a workshop for oncology nurses in Robert Johnson Hospital, where knowledge and skill needed for positive patient outcome will be provided. My goals are to ensure that we do provide safe and quality care for our cancer patients, for us to be able to reduce the rate of readmission and reduce the length of stay in the hospital, and to be able to reduce the staggering healthcare costs due to preventable infections. And the other ones are to reduce mortality and to ensure positive outcome for our patients. My objectives are, by the end of the workshop, my participants, which are nurses, will have the needed knowledge and skill to perform a complete assessment of patient at risk for neutropenia and infection. Because when you're able to, once you know that somebody's white count is very low, definitely you know that kind of person is at higher risk for infection. So you should be able to be proactive in doing things that will prevent infection. So the other objective would be to use SBAR. SBAR is an acronym for Situation Background Assessment and Recommendation, to effectively communicate with peers on signs and symptoms of infection. This I mean that nurses will be able to, once you go in there, because you go into the patient's room, when you give them reports, you give the, what the situation is, the background of the patient, and you assess the patient and what are recommendations do so that you can prevent infection for such patients. The other one will be participants will properly identify 5 strategies to support core principles of patient and family-centered care relating to infection prevention. We do know that even the patient do acquire hospital infection, it could not only be the hospital, they could acquire infection from everywhere. Even when family comes in to see the patient, maybe by not washing their hand properly and touching the patient, or by giving them foods which they are not supposed to eat, because patients, when they are neutropenic, they're not supposed to be eating like fresh foods that are not washed or that are not cooked, but sometimes the family brings. So we want to be able to incorporate the family members as well as the patient with the nurses. So it's going to be like a team work so that everybody will be able to prevent infection. And the other one will be participants will demonstrate effective hand washing. I do find out that most nurses and doctors, most healthcare professionals, they do not wash their hand properly. And unfortunately, we do that because these people, I mean, when I say this people, I mean the patients that have gone through chemotherapy, their immune system are kind of compromised. And we need to wash our hand, because when you touch them, especially the central line or the food, the medication, you need to wash your hand properly. And not just washing hands, because there are procedures in washing hands. So I want the participant to be able to know how to do proper hand washing. And the other one will be participant will be able to demonstrate proper technique for central line dressing chain. This is a biggie. Most of the patients, because when you're giving most of the chemotherapy, you cannot give through peripheral line. So it has to be through central line. And I found out that most of the patients, they get infection through the central line. So we end up taking out the central line, maybe the port with the portacart or the PIC line or the triple lumen catheter. We end up taking them out because they get infected easily. And this is due to the fact that nurses, because we are the one that draw blood from all these lines, we are the one that gives some medication through them, IV fluid. But unfortunately, and the dressing has to be changed at a particular time. But unfortunately, we found out that most of us are not following the protocols. We're not doing the proper things. So they end up with infection through the central lines. So at the end of the workshop, I want the participants, which are nurses, to be able to do proper central line management. Okay. So I'm going to go over the theoretical framework. I picked 2 people, 2 theoretical framework for this project. Those theoretical framework, the 2 of them are basically based on adult learning. So the first one is Bandura, so which is self-efficacy. The principle for the theoretical framework for Bandura says self-efficacy is an individual perception of confidence in one's own ability. What it's trying to say there is for you to be able to do anything, you have to be confident that you can do it properly and you can do it. So when people don't know how to do things, sometimes they avoid it or sometimes they do it the wrong way. And The other one says a performance accompaniment provides immediate evidence of whether or not one can succeed at a particular behavior. What this is trying to say is once you know that you can do something and you accomplish that particular procedure, then that gives the confidence that next time you'll be able to do it or be able to do better, even when something else comes, which will be different or whatever. For example, once you know how to do the product art management, then definitely you know you're going to be good at peak line dressing too, which is basically almost the same thing. And another one says past successful experience tend to raise self-efficacy and successful experience to tend. What it's trying to say is that once you know you've been doing something successfully, that gives you a kind of confidence to be able to say, oh, I will do something. But once you are unable to do something, that gives you a kind of you kind of retract, and because you do not have the confidence, so you might not want to be able to do things the right way. And the character experience gained by observing another person's success and failure, especially one who is perceived to be similar, tend to raise certificates. What this is trying to say, for example, if I'm going to teach them, because I'm a peer, I'm a nurse just like them, so when they see me do things and do it the right way, they know they can do just where I'm doing it, that can give them some kind of confidence to be able to do the right thing. Understanding how one's emotional state or psychological factor can subconsciously affect performance has been found to improve self-efficacy. What this is trying to say is once you know your ability, your limits, that it can give you the idea maybe of what you can do and what you cannot do. For example, if you don't know how to manage a proper management of central line, you might not be able to do that, will not give you the confidence to do it. Or even you don't even know that it has to be changed every 7 days, or maybe according to the protocol of your hospital or the facility you work in, you might not be able to do the right thing. This is basically talking about adults, because all these are part of the adult learning theory. So talking about how. The other one is Malcolm knows. Malcolm knows too is just all about the adult learning too. And what he's trying to say is that adults are internally motivated and self-directed, because most of the people that are coming to this workshop, they are nurses. They are coming not because they're being forced to come. They come because they're motivated. They want to learn, because that's their motivation. They want to be learned to be able to do the right thing. So that's where most of them are coming. And that's what the Malcolm is trying to say, that you cannot force an adult to do things. They come when they know they are motivated to do such a thing. And another one says that adult brings life experience and knowledge to learning. That is, when you come, because most of us, we have past experiences. We're not just coming because we're nervous, because we know things. We have experiences maybe with frontal line, with peripheral line, with infection. So we all come, even when you're coming to learn more, you come because you have experiences. So maybe just to impact more on the knowledge that you already have. Adults are goals-oriented, because there's a goal for you to go for any learning or for any knowledge acquisition. So their goal is to be able to improve upon what they already know. So that's what Malcolm is trying to say, that when you teach adults, you should be, because they have a goal. And each adult, their goal is for them to be able to learn more, to be able to acquire more knowledge and skill. So that's part of the adult are practical. What they're trying to say, the adult want to see that things they are doing is not something that is too virtual. They want to see that, oh, what I'm doing is something that is realistic. Okay? And the other one, the last one, says adult learners like to be respected. What it's trying to say that when you teach an adult, you want to be able to respect them, to let them know, hey, you're not treating them like a child. You want them to be able to know that you respect their opinion, even when their opinion is different from yours, or maybe when they don't do the right thing, you still want to respect them and correct them in the right way. So the way these theories are incorporated into the workshop is just the way they are said there, that in the workshop, we make sure that all the nurses, we respect them because they are nurses. We believe that they have knowledge and understanding and wisdom, so we just want to improve upon the knowledge they already have. We just want to let them know that their goal is for them to come and learn in these workshops. So, and again, we want to be sure that they are seeing what we are doing, that we're doing the right thing according to Bandura, so just to improve upon their self-efficacy. So that's the way this theory is incorporated into the workshop. And I did some literature review because I want to be sure that there have been studies on these things. So what I did, we did literature review on what neutropenia is all about, how does it affect infection, and we did literature review on antibiotic, because people that are infected, they need to be treated with an antibiotic, and the more, the faster you initiate antibiotic therapy, the better. And we I did a literature review on evidence-based practice, because all these things that we are saying, the evidence-based, because we want to be sure that it's something that is real, that is, the evidence has shown that this thing is going to work or it's not going to work. So, and I did a literature review on catheter-acquired urinary tract infection, because we know that when patients are neutropenic, once they have catheter is another way, maybe like central line catheter or maybe urinary catheter is another way of acquiring infection. So we do realize that they are prone to infection. So, and I did some literature review to be able to prove that these are the facts. And I did a literature review on strength line management and dressing change. Like I said strength line is a biggie, especially with the chemo patient, because they get their chemotherapy through central line. So we did some literature review on strength line management to be able to show that when strength line are not properly managed, they cause infection. And I did another one on gaming and simulation. Gaming and simulation is just the way adult learns. So people learn from different ways, because literature are proving that people learn from different ways. No one method is superior to the other, but there's different ways. Like gaming, even though it's fun, people learn from game and simulation. People learn from simulation a lot, especially adults, so because they want to see each particle. And we did literature review on different learning style, like I said, and critical thinking of different people. So to support the way, and that is what we have incorporated into this workshop, to be able to impact knowledge. We just don't want to organize a workshop, but I want to organize a workshop that will impact knowledge into people, that is going to make a difference, so that people will be able to change from the wrong way they've been doing things before. And lastly, like I said, so these are the way this literature review impacted the workshop. So the plan, the workshop, like I said, was carried out at Robert Wood Johnson Hospital in the oncology unit. And so because they are nurses, like I said, so it's basically for nurses. So because nurses want to be able to teach the nurses, so that nurses will be able to teach one another, and will be able to teach the family, and be able to teach the patient on infection prevention. And that's exactly what we did. So the workshop was divided into 2 sessions, because it's supposed to be a 3 hours in workshop. But we do realize that if we have to take all the nurses away from the unit into the workshop for 3 hours, patient care will suffer. So we decided to work with the head nurse and the director of the unit. So we divided the session into 2 sessions of 90 minutes each, so that because we want to be able to maximize the number of participants in the workshop. So we did say, okay, work with the schedule. So some people can cover the other nurses while some are attending the workshop, so that nobody will miss out of the shop, because it's a very, very important workshop, so that we will, because like I said, we've been having issues with infections, and we believe that this is going to make a very great impact on the nurses. So, like I said, and what we did was I tried to cover all the 5 objectives that I already mentioned earlier on in this project. So each objective, like I said, were covered. And what we did was in the workshop, we used different methods of learning, different tools, because we have the audiovisual aid, we have the posters, we have the billboards, we have the handouts given to nurses, and even I gave them self-learning packets so that they'll be able to read on their own too. And what we did again, we made it kind of interactive. So it's kind of a discussion class, so we made it interactive, so that people will be able to ask things, and we'll be able to, because I don't want us to make it like a one way, because if we make it one way, just giving instructions is going to be boring, because they already know. So, but we want to know what they know and how you can make a change, and you want to be able to learn from them too. So that's what we did. And when we're doing that, we make sure that questions are being asked and answers are being given as appropriate. And we're doing that too. We're using the simulation, the simulator, which was provided by the IT department. So we use the simulator, and we were able to. But the big thing, because I know, like I said, they are all nurses, we're all knowledgeable nurses in Robert Wood. So because Robert Wood is a teaching hospital, and it's one of the best hospitals in New Jersey. So most of the nurses are knowledgeable. So we just want to improve upon the knowledge. So what I basically did, we put more emphasis on hand washing, because like I said, the observation is most nurses, they do not wash hand properly. So we did a lot of sessions, put a lot of time on hand washing and central line management, because like I did say, most of the infections are through the central line. So we did that. And fortunately for me, the unit and nurse educator and the head nurse, they gave me a hand because due to the master's program, so almost finishing the master's program, she's just like me. So we were able to teach. We already have a skill validation list of the proper things to do with central line and hand washing. And so we did that, and we were able to let the people demonstrate, or we demonstrate the skills. So at least in that doing, then we were able to check them up to ensure that they're doing the right thing. And once we found out that mistakes are being made, we make sure those mistakes are corrected right away too. And whenever we find out that they're doing the right thing, we reinforce that. We give them positive feedback so that they can continue doing that. And that's the whole thing. And I gave some light refreshment, and that's how the whole thing went. It was a very successful workshop. Hopefully, the nurses will be able to impact the knowledge that they gain from this workshop into their daily practice. I'm hoping, I'm looking forward to a reduction in the rate of infection on the units and the rate of readmission and the rate of and the length of stay. So that, because once we're able to reduce infection, we'll be able to reduce the cost of healthcare. We're going to be able to reduce the length of stay, and we're going to be able to reduce the rate of readmission. And to top it off, we're going to be able to increase patient quality, because everything we are doing is all about the patient, not about me, not about the nurses, but about the patient. So we'll be able to give them quality care, which they deserve, and that's exactly what the thing is all about. And for evaluation, and like I said, we did a redemonstration of hand washing, and we did a skill validation list for the central line. So we were able to check and see that they did the right thing. So that's how we're able to. And after that, I gave out a question and answer, and a questionnaire on the content, the environment, the tools, and the skill, and everything they were able to learn on the workshop to be able to know, so that subsequent ones, if we need to do make improvement, we know where improvements needed to be made, and to be able to show and to be able to be assured that they already learned something from this workshop, and there's a takeaway from the workshop, and the takeaway is infection reduction in order to improve quality care for our patients. And the future implication and conclusion. So the future implication and conclusion for this workshop is, from my own perspective, I believe that infection prevention will be achieved with good practice of hand hygiene. Like I said, most of the infections are through contact with our patient. When we don't wash our hands, we open their medication, we give them food, we give them the things that they need. When we do central line, wound care, all those things, and even the medications. So we need to be able to do proper hand washing to reduce infection. Not just hand washing, we have to scrub at least 20-30 seconds and wash with soap and do the right way that I've just taught them. And the other one I say is the use of maximum barrier protection, because some of the patients, they are on contact isolation, some are airborne isolation. We need to be able to wear the proper barrier from one patient's room to the other, because we don't want to be able to carry one infection from one patient to the other, especially people that are neutropenic, because we know they're already immunocompromised. So we don't want to carry one infection from one patient to the other. And the other one says good management of central line and urinary catheter, good perineal hygiene, and quick initiation of antibiotic therapy. What I was trying to say there is, when some of those people, they don't even need a urinary catheter, because the evidence have shown that the more the catheter stay in the patient, the more they are prone to infection. So we want to be sure that patients that don't need infection and don't need a urinary catheter, we take them out real quick. And we want to be sure that people with central line that the dressing are changed according to protocol. In my hospital, it's 7 days. Or probably if we find out they are soiled or they are not properly covered, we take them out and do the dressing change right away, because that's a real source of infection. And the other one I did say that the upfront cost of infection prevention are small when you compare the cost of treatment of acquired infection. What I'm trying to say here is that even though preventing infection requires us to spend some money, but if you find out that, like I said, some of these patients, they stay in the hospital for like 90 days, 100 days due to infection. So imagine, like in my hospital, for you to stay in a room, it's $1,000 per night. What about the other medications? What about the antibiotics? So imagine if somebody stays extra 30 days, just for the room alone, that's $30,000, not to talk about the medication. But we can spend $30,000 to prevent infection for that particular patient. So, like I said, the cost of prevention is way, way minimal when you compare that cost to the cost of curing. So I think it's better to prevent than to cure. And I did say the resources saved through effective prevention education could be reinvested into future improvement in patient care, which will also improve patient outcome. What I'm trying to say is, instead of us spending so much enormous money to cure patient, why can't we use that money? Because it prevents infection, so we know we can use that money for maybe research and development, for patient care, for quality care, and for doing other things that we need to do for the patient, rather than curing infection that are preventable. And that's the conclusion of my project. And like I said, I hope the nurses, and I believe that they took away some knowledge with them and skill with them, and I believe that once they get back in the unit, they'll be able to impact and utilize the knowledge and skill that they've acquired. I just want to say thank you, and I dedicate this my workshop to all cancer patients in the world. And once again, I would like to say thank you to my counselor, Dr. Barbara H. Sator, for our encouragement and for making a successful career and a successful academic year for me. Thank you.